Hello, I'm Jess Gomez here at the American Thoracic Society's International Conference in San Diego, and today I'm joined by Dr. Denitza Blagev from Intermountain Healthcare, who presented an exciting study today regarding patients with COPD and a new risk score stratification system that you have developed to identify those patients who are at high risk and may require hospitalization. Tell us a little bit about it.
So we were interested in looking at whether, with all the variety of different kinds of data we have in our electronic health record, we can find information that can be valuable in helping take care of our COPD patients. And so we derived the LIV score, which we validated in a national VA population and internally at Intermountain, in about 48,000 patients in Intermountain, over 80,000 patients in the national VA system. Wow. In prior work that we presented last year, we showed a correlation with mortality. So by just a few simple lab variables, we can find mortality differences in patients. And the work we presented today looked at the risk of COPD hospitalization or emergency room visit. And so that was exciting because now, with really simple algorithms based on lab values, we can identify a patient population of patients with COPD in our health system and try to design things that can hopefully improve those outcomes and reduce the risk of hospitalization or mortality.
And the unique thing about this stratification scoring system is that it is real time, and you're essentially using regular laboratory tests that are done day in and day out.
Exactly. So the nice thing is that it can be done in real time because it runs in the background, and it's really data that are collected routinely clinically. And this is one of the reasons that it was easy to validate at external sites, and we were able to validate it because there's just very little variability in lab values across healthcare systems. There is a lot of variability in terms of who gets called what diagnosis or other kinds of care processes across health systems.
And from a benefit standpoint, we're not only talking about improved care, we're talking about improved quality of life, but also a potential savings of healthcare resources.
Right, so this will really tell us who's likely to have, who's at high risk for having bad outcomes, whether it's hospitalization or mortality. And then the key for us as a health system is really to be able to target interventions at that particular patient population and help them prevent those outcomes from happening. It also is an important, I think, value for patients so we can look at the trajectory of what COPD might look like for them.
Well, congratulations on this great work, and thank you for being with us, and thank you for joining us today. Have a good day.